On your left, you see the categories that are remaining open. All pre-K, elementary, and middle schools will stay open for full in-person education of our children. I have talked at length at these press conferences about the vital importance to our community, to our families, and to our children, particularly our youngest learners, of being in school as much as possible. And so we want to keep these kids in school with all the precautions we have, and we want that to happen unabated. And the data and the health experts continue to say there is no evidence to suggest this is unsafe, and in fact, there's mounting evidence to suggest our children are truly suffering by not being in school. Dr. Ashish Jha, who is an expert, put out a fantastic paper just a day ago, making it crystal clear after a survey of all the data that there is no evidence that in-school learning is a spread. I have talked to Dr. Fauci, Dr. Birx, the CDC, our own experts, Dr. Jha, people at Johns Hopkins. Look all over the world, all over America, and all over Rhode Island. There's no evidence to suggest they are vectors of spread. In Rhode Island, where, to the extent we've had any issues, it's in high schools. Like I said, the only places we've had like 10 or more cases is in a high school, for all the reasons that I said. You know, kids are mobile, they're not in pods, et cetera. So anyway, we could argue about what is the risk, but about this we cannot argue. There is a 100% certainty that children will be sicker mentally, physically, emotionally if they are out of school. And they will suffer, in many cases, irreparable lifelong harm.